Welcome back and many thanks for joining us for yet another insightful conversation that is largely centered on the reopening of schools. You have the Initiative for Social and Economic Rights that is actually calling on government to actually address the uncertainty surrounding the reopening of schools. I do have Salima Namusobya. She is the Executive Director for the Initiative for Social and Economic Rights. She joins me right now in studio. Remember, yesterday there was a cabinet meeting between education officials and some of members of the cabinet to actually discuss how they can reopen schools in a safe manner. Well, but then nothing culminated out of the meeting. We do know that the National Council for Higher Education last week actually called on public universities and public and private universities to halt the phased reopening. By Saturday, Chambogo students had already gone back to school. Right now, after Inche halted the reopening of schools, you do have many of those students still wallowing in uncertainty in the hostels in the respective public universities. And on the issue of online teaching, many of the universities are saying we cannot actually start online teaching without getting these first-year students through orientation and induction. So you have so many modalities that are being looked at, but as it is, schools are still being shut down. Let me engage Salima Namusobya, the Executive Director for the Initiative for Social and Economic Rights. A very good morning.
Good morning, Romeo.
What is your take on the current uncertainty surrounding the reopening of schools, Salma?
It's quite disappointing that we find ourselves in this situation because, as you may recall, COVID-19 was upon us like early last year.
Indeed.
And the schools and other education institutions were closed in March. So government has had over 8 months to really prepare for continuing quality education. So it's quite disappointing that you read in the papers and the picture being showed is like there's an impasse between the education people and the scientists, which really points to the fact that there is a lack of coordination between the different government departments, which shouldn't be happening. For us as citizens, there should be collective responsibility on the side of government, and we should not be hearing arguments such as Ministry of Education says this, Ministry of Health says this, because at the end of the day, this is really costing the country.
We do know, Salima Namusobya, that even some of the education officials who are actually in that meeting have schools that they are running. And the information we are getting, some of the schools already reopened by last week for those education officials who are in that meeting. And we also do know that the same education officials want schools to be reopened, and the scientists are saying, no, we shouldn't reopen. The education officials are saying, if the children are going to the malls, the arcades, Chikubo, and so forth, why not conduct maybe a phased reopening where students can go back to a safe environment where they can study?
Romeo, I do not have the information about some of the schools that have reopened, but what I can certainly tell you is that this crisis is beyond just us talking about reopening of schools. It's a crisis of education that the country must look at as such. And there are a number of things that we've pointed out over time as an organization. And first of all, it is the persistent underfinancing of the education sector. And this is what is partly resulting into the crisis that we have at the moment. Because the fear is that many of the schools are not able to implement the COVID SOPs.
Because we saw the same problem when we allowed last year's students to join.
Because there's a lot of congestion, for example, in many of the schools. And we've always said that, you know, the classroom, the pupil to classroom ratio is simply too high in this country for both public and private schools. And this is something that the state has been very slow in addressing, but here it is. It has caught up with us. COVID is with us for a very long time, and we must have a way out. And why we are arguing as the Initiative for Social and Economic Rights that there should be reopening of schools, it is not for the sake of it. And we are not saying schools should open just like that in a manner that is not safe, but it's because we've monitored the education sector since the closure of schools. we've monitored the implementation of the remote learning program, the continuity of learning program, and we've come to the conclusion that actually there is no learning happening for especially poor and vulnerable children
who cannot
but
access the
also
internet.
children with disabilities. So we find ourselves in a situation where children who are from well-to-do families are able to access some form of education. It's either they are in an international school, which was allowed to open because from what was said, international schools have smaller numbers and they can handle having the children back in school, or they are in accessing education online. Their teachers are teaching and parents are paying a lot of money, which these other students cannot afford to pay. But even being in their condition, there was this whole program of giving hard copy materials to students in remote areas. But then this is not working. We already raised the issue that, for example, children with disabilities do not have appropriate materials for them to be able to learn. But also the socioeconomic circumstances in many homes do not allow for the children to simply sit and concentrate in their homes. So what is happening is, what is resulting from that is we are seeing cases of harmful child labor. We've been to the districts of Buikwe. Currently, we have a team in Moroto. We have people out there in Nebi. And what is happening is that, you know, like children are mining, children are on plantations, children are fishing, you know, and many of them are being exploited. It's not that they're even getting a lot of money out of this, but they just have to be supplementing the incomes of their homes. But also we've noticed a lack of interest a dropping interest in school. So some of the children who have been able to be exposed to the labor market, for example, in Buikwe, there was a head teacher who was saying, you know, he meets his students who are now riding boda bodas, and they're like, Master, we are not coming back to school. You know, can we give you a lift? We now have money. So that is the situation we find ourselves in. But we also monitored the reopening of schools
for
the candidate
reopening
classes.
Of schools, you talked about child labor. There's also the case of the rising teenage pregnancies as a result of young women.
Absolutely, which is what I wanted to talk about with the reopening of schools. We found a number of schools where many children had not returned to school. One of the key reasons was because of pregnancies, especially for the girl child. For the boys, it's that they had somehow entered the labor market and they are not interested. And then there was the issue of cost. Because of the impact of COVID-19, there has been a reduction in people's income, and many parents were not able to meet the school requirements that are required for the kids to get back to school. But then there's also the issue of privatization of the education sector, which again, we've persistently raised that education is supposed to be a public good. And where a country has a situation that has education commercialized, then we're in problems. And indeed, with the reopening even for candidate classes, we saw that many private schools did not open, simply because the owner has changed user. They have turned it into maybe a hotel or sold it off or turned it into apartments instead of a school. So many children found themselves in a balance. They are not able to access school because that private school was the nearest school that they could access. A few who were lucky were able to join some public schools that do exist, but many of them are at a distance. And there's considerable challenge. But also right now, there's a lot of exploitation. For many schools that are managing to do online schooling, it is for a very high cost. Many parents are paying over 150,000 a month for their kids to be able to continue with education. So we find ourselves in an unsustainable situation, and it's really concerning that right now we are in a situation where the Ministry of Education or the government in general is not coming out to tell people what exactly is happening. There's a lot of anxiety. There's a lot of stress on both the parents and the students. There's nobody knows which way we are going.
But this is what the scientists are saying, especially from the government side. The presidential advisor on epidemics and pandemics, that is Dr. Musenero Monica, she did say that why not wait for 3 or 4 months and get a vaccine, and then we can reopen schools, because she feels like there will be an exacerbation in the spread of COVID-19 if we let all these students go back into that setting.
Romeo, I can tell you it's dishonest for a government official to stand up and tell the public that we are going to have a COVID-19 vaccine in 3 or 4 months that is enough to allow for kids to go back to school. First of all, and this again as the Initiative for Social and Economic Rights we raised last week, we raised the fact that the government is again quite quiet on what is happening with preparations for getting a vaccine. We know from sources that the government has applied to get some vaccine doses through the COVAX facility, but those doses will not be enough. And already there is conversations of who will get it first. The health workers, maybe older persons. I had also security forces. The children are very far from that list in terms of who will get the vaccine. So in the absence of a proper plan to get enough doses to impact on the entire community, to be able to know that very many people are covered, it is dishonest for us to say let's wait 2 to 3 months. That is not going to happen. It is going to increase levels of frustration among the public, and it will be very unfortunate. I think the government needs to come up and be open with the public. This is what we have. We've been told things like masks, hand washing, you know, they work. So why not work with something that is within reach for now? We've seen globally there is this whole conversation around vaccine nationalism. And on the ground, we've had rumors that our scientists are working on a vaccine, but even a vaccine, we've had the rumors.
But we started trials.
But nobody has come out to come and tell Ugandans that indeed our scientists are actually working on a vaccine. So what we know is that we are relying on what is going to come from abroad. And I can assure you, you've seen the fights, even among the Europeans, the Americans, South Africa is fighting, and Uganda, we are waiting for what we shall get. I heard from one doctor that we shall get 9 million doses of the vaccine from COVAX, but this is a population of over 40 million. So the impact of the 9 million doses, and remember, for a lot of these vaccines, you get 2 shots. So you first take the 1 shot and then you wait for another. So I think our continuity of education should not be dependent on whether we are getting a vaccine.
And you have people
we are in a crisis that is going to bite us years later. You know, we find ourselves in a community, for example, the East African community. How are we going to compete with the rest of the countries when we have a half-baked population? Losing 1 year out of education, I can assure you, is going to come back and bite us. But also what the situation is doing to us is that now there is flight of the well-to-do from the national curriculum. People are now spending more money. A person who is spending, let's say, 2 million to take their child to a private school in Uganda, because that school is not opening, they are now thinking about the international curriculum. And even if you're very conservative, the cheapest you will find will probably be 5 million a term. So for a year, that person is taking out over 9 million shillings from what they could have been putting in business. So you find that many families are now considering their kids going into international school, and you're leaving the people who are cash-strapped to be stuck within the system. And many people have been actually cynical to say that this government is not caring simply because their children have alternatives. They do not know what is on the ground. We have a crisis on the ground that if we do not deal with urgently, we are going to have very long-term consequences that this country does not
Yes,
need.
Salma, there is an education crisis simmering on the ground, but there is also a COVID-19 crisis. But you do hear
Absolutely.
from people who are saying, well, there is a reduction in the number of cases that are being registered, especially in January. They are looking at what happened in December and then January, and then they are saying, no, 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 the cases are reducing. We should be reopening. But what they do not know is Ministry of Health is targeting the riders at the border. You have the truck drivers, and then some of the travelers, few people. They are not targeting the community transmission cases. And even the few cases they've managed to sample, they all came out positive. So the scientists believe there is widespread community COVID-19 cases that haven't been discovered, and that's why they are saying we should halt the reopening of schools. Ghana on Sunday announced another shutdown. Schools had been reopened, but now they're going back to a lockdown simply because of the 60,000 cases of COVID-19 that they've discovered. Don't you think we should tread carefully on this path, Salma?
Romeo, where we started from, we said we've had over 8 months to plan. And we've seen that there has been money raised for COVID-19. We saw money coming in, for example, from the Global Partnership for Education. We've seen different agencies coming in to say they will assist, for example, UNICEF. And what Ugandans were thinking is that there is some kind of plan. Maybe government is expanding the infrastructure that, like we've seen in other East African communities, to be able to accommodate more children in a more socially distanced manner.
The election
but
blighted all
this
that.
did not come. Then there was the discussion of remote learning. And then that discussion came with promises of radios, for example, to enable kids who are in remote areas to be able to learn. We have not seen the radios. We do not even know where that conversation ended. But we know that somehow, at some point, some government officials said we've secured funding for the radios. I do not know where that conversation ended. There was the issue of the learning materials. But the materials, the hard copy ones that were distributed, could only cover 25% of the population. So, and also coupled with the challenges that I've told you are happening on the ground, leave alone these urban children that all of us are being exposed to. Go to districts outside of Kampala. Even in Kampala, the urban poor are having similar challenges. But just get outside of Kampala and you will see that there is no learning. One time, let me first finish this. We also talked about the issue of radios. And we were telling government that even if you bring the radios, there are places. Go to areas, for example,
Border
around Elgon areas. Go to areas around Amudat. People there will tell us, guys, talk about your radios, do not involve us.
We get the signal from these other countries.
Because we do not get a signal, any signal from any radio station in Uganda. So for them, regardless of whether you're going to purchase radios and distribute it to them, it is not useful as long as there is no radio station that is getting to them. But also there has been arguments from people who are more technical around education that it is not a very effective mode of learning. I cannot discuss that in detail because I'm not, an expert on the subject. But there have been these sentiments of lack of feedback on television, lack of radios on television. But, COVID is here and it is not going tomorrow. So the plans have always been, let us shut down as we prepare ourselves to open safely. And but for children in particular, children in particular, I think the school setting actually would do better in terms of getting them to adhere to the SOPs. But right now, you walk Kampala streets, for example, we are always up country, and children are all over the place. There's no mask, there's no hand washing, there's nothing. And yet in the school setting, if we are organized, actually, the children would be able to actually engage in hand washing. So in all of this conversation, we are not denying the reality of COVID. Not at all.
Let's talk about the double standard that accrued after government shut down the internet. Yet you did have education officials who were saying instead, even the scientists who were saying instead of going to school, please go online and continue studying. How has the internet shutdown affected online teaching? We have teachers who are saying for us, we used to use WhatsApp to send these messages and track our students, but now the ordinary SMS cannot do what social media can do.
Absolutely. That is the inconsistency that we've been talking about, and the confusion that obtains at the moment, that with the shutdown, you also had children being affected. And it was quite hilarious to hear primary children start to talk about using VPNs, because for many of them, even to access their Zoom classes, they had to get a VPN somewhere. So if you're going to have particular policies, then you must be genuine and consistent in terms of applying them. So the internet shutdown, of course, it affected people, and especially the people in urban areas. Many found their way out because some of the classes happened, but it is really concerning that there are children in this country that have never experienced any form of learning since the closure of schools in March.
In rural areas.
And for these children, the only way of resuming learning is going to be through
So do you believe
reopening.
these social inequalities will be exacerbated if this shutdown on schools continues for the next 3 or 4 months?
That is the point we made. We had a press briefing on Sunday, and it is the point we are making. That first of all, we need to go back to the functionality of education as being able to develop people fully into people who can meaningfully contribute to the society. But it is also that equalizing tool that is used to narrow the gaps between rich and poor, to narrow the gaps between genders. You know, it is a very important tool, even now when everybody is singing SDGs, of which Uganda is seen as a champion. If we are going to ignore education, the gap is going to widen. So for now, you will see that more girls have dropped out of school because of the challenges, early marriages, teenage pregnancies. But we are also seeing the poor, they are going to have a gap of over a year of not learning, and yet their counterparts are being able to access some form of learning. So this is a situation that will only widen and will cause frustration, which is important, because many people tend to divorce the discussion of, for example, social services like education and health from the discussion on security, for example. But a frustrated community is just waiting for a spark.
So, and it seems like more than ever, now more than ever, that the safest place a child can be is a school setting, especially that's what the COVID-19 pandemic has taught us. But then, how safely can we reopen schools, Salima Namusobya? First reopening?
Before you say that the safest place that a child can be is in a school, I think one of the most important things that COVID has taught us is the importance of quality public education and health services. Because with the education sector, you will see that part of the problem that the state has grappled with is how to deal with the private sector in education. You've seen the fights that have been happening, you've seen the reluctance to open schools, and if the government invested in quality public education, I think our burdens would be less. They would be able to implement the SOPs, for example, in their schools in an easier manner than not knowing what is happening in each private entity that exists. So for me, I think that is the most important lesson.
Indeed.
Investment in quality public services.
So here we are with meager funding or financing for many of these schools. Even when we had allowed finalists to go back to the school setting, there was difficulty in implementing the standard operating procedures. Aren't you worried now that we are calling for or clamoring for mass reopening that it might be even more harder for schools to implement standard operating procedures with full house?
You know, and again, this is where I will go back to the learning that we've had of the public systems, because the government, with the money it has secured, it had indicated it is going to work with the public schools to be able to implement the SOPs. The private schools, amidst, you know, wanting to make money and, you know, how much money parents are able to pay, they will always have shortcuts. They will always have shortcuts. So you'll find that it's only the high-end private schools that will be able to implement. Now, with the public system, if the funding that is going to these schools is limited, then you're going to have a problem of implementation of
I see.
SOPs. But if the schools are actually well facilitated to do this, they will be able to do it. So it goes back to underfinancing of the sector, a sector that we see is core to the development of this country.
And it also goes back to what
as a
government
whole.
should have done. But then the reality on the ground is the schools do not have the funding or the financing to implement these SOPs.
And yes,
but
they
if we
should.
allow, they
should
but
be
they
having
don't.
it because,
But they
like
don't.
I told you again,
Yes.
a lot of money has been secured.
So should we first deal
for COVID-19?
So should we first deal with the financing aspect?
Where is the accountability
Yes.
for this money? What has the money that was secured done? We have seen that the government, first of all, we've had so much talk of people saying, oh, we are going to monitor to see how the schools that have reopened have performed. We don't have that report. Nobody has come back to say these many schools had COVID-19 cases. Nobody has come back to say this is how many schools we were able to support with the COVID-19 funds that we raised or borrowed. Nobody has come back to tell us actually whether there are any dangers in the schools.
Actually,
so as long as the
around December, there was talk about how many of the schools were actually being hit by the COVID-19 pandemic. There was an exacerbation of COVID-19
Where did
cases.
that talk come from?
From the Ministry of Education. They were saying there was an uptick in the number of COVID-19 cases in the schools where they had allowed finalists to come back.
And what happened?
The conversation disappeared as we veered into the election, especially around January.
Because there is no consistent
in
messaging around this. So for us as a public, as far as we are concerned, we've seen a lot of borrowing, we've seen a lot of fundraising. We know that from the consolidated budget, there is supposed to be money to respond to COVID.
Indeed.
So as long as now we cannot sit and just say, you know, COVID is still with us. We expected that the government should be preparing for us because COVID is going to be here. And we have to coexist with it. And like I've told you, there is no learning. The whole discussion around continuity, remote learning, that is not happening. Whatever is happening is what parents are able to pay for. The government side of things, you saw the other day, you're the ones I think who ran a story of the fact that the papers that were distributed are being used for mandazi and whatever, things like that. Children are not learning. So we have a crisis. We must deal with it. And government has to sit at the table and allocate the proper resources that are needed to enable learning to go on. The context that we have as Uganda.
And that's why I wanted a clear-cut response. We were talking about what should have been done to finance these schools before the reopening, but it was never done. The reality is the schools are being underfunded and we are calling for a mass reopening. So what should government do? Focus on fast sending resources to the schools so that they can be able to implement SOPs, or we just go ahead with phased reopening?
To implement SOPs, but also there is an ongoing project of expansion of the public education sector.
Right.
And this should be accelerated to be able to enable these public schools to take in more kids and also decongest the existing schools.
I hear you.
Because if we do not really learn from this experience, we are in for a crisis that is going to hit us for many generations to come. Because we are going to have a half-baked labor force that cannot compete, not locally, not regionally, not internationally. And this shouldn't be happening. But also we find ourselves that the state is currently violating the right to education, which shouldn't be the case. So we need to invest very fast. It's urgent.
The state is violating the right to
of
education, but there is the right to health. And that's what the scientists are saying, that they are trying to protect the children from being from going to a setting where their health can be compromised.
How are they protecting the children in their current context while they're at home?
And that's the argument of the education officials, because they are saying these
Don't
students
you
are
see the
still in
children on the
Chikubo,
streets
going out there on the
hawking
streets.
things?
Yes.
Don't you see them in the mines? They are everywhere and in a more uncontrolled situation. And let me emphasize this. We are not saying schools should open what people call for, you know? Schools should open in a safe manner. Let's deploy the resources that have been collected, that have been borrowed, to put into schools reopening and be able to get the children back in school. Otherwise, the situation we have now is unsustainable.
So the education official and the scientist who is watching now is asking him or herself, how will we implement the phased reopening? So in your view as ISER, how can we implement the phased reopening?
They've had the SOPs for a very long time. The Ministry of Education, of Health released them a long time ago. And what we expected is that they've been working together to implement these SOPs, to go to the schools, tell them hand washing, this is how you're going to ensure social distancing. Perhaps some of the classes will be had outside. We trusted them as the skilled people, the experts, both in health and education, to be able to pull this off. We find ourselves in an untenable situation where the only option, especially for poor and vulnerable children, is to go back to a school setting. And they have to find ways of doing this in a safe manner.
Of course, even the first-year university students are saying they first have to go physically to these institutions, register before they can go back to online teaching. And they're calling for at least 4 weeks. Most of the vice-chancellors of the universities that we have in Uganda, Barara, you have KIU, you do have Makerere University, they're saying, can we find a way of phased reopening? At least 4 weeks, we could have the first-year students come in and we register them. And they go through what we call induction and acquainting them with the course units and so forth. And then you have the second year continuing students, then the third year continuing, like that.
And the situation with universities also is what shows you a lack of coordination within the different government agencies. You saw that Makerere University, for example, announced freshers are coming in on this date and whatever. They didn't dream up that date. It came from somewhere that they are supposed to open. So it's after a few days that we saw the letter from National Council for Higher Education. So what is happening? It seems like there is nobody talking to the other. And like I said, the vaccine is long coming because we shall get some doses, yes, but not enough to have meaningful impact to say we should wait for the vaccine.
So we shouldn't wait for herd immunity. And another
we
issue,
should not wait for the vaccine. The doses we are going to get, unless if they come up and say, here we are, we've worked on a vaccine, we can massively vaccinate. You know, in the absence of that, we have to find ways of continuing without necessarily having to sit and wait. You know, the harm that is now happening with the current status quo outweighs the dangers that are coming from COVID-19, especially for the children. You know, so you find that the harmful impact is going to cost us more than what we would be having if the children were back in school and learning safely. Catching up on a year's loss in education is not an easy thing.
But 2.2 million deaths have been registered on the international scene. You
on the
are
international
not worried.
scene.
In
On
Uganda
the
here,
international scene.
325.
And like I told you, it's not that we are saying just open. The
Phased
opening
reopening
must be done in a safe manner that respects the SOPs. And that is the promise that was made to us. Each time the president came to the TV, he said the scientists are working out a plan together with their counterparts in Ministry of Education. That plan came, and we expect that it should be implemented.
All right, we've run out of time, Salima Namusobya, but then there's this pertinent question I wanted to throw your way before I let you go. So does this mean with some schools reopening and others still being shut down, aren't you worried that it will increase the social inequality gap that we are dealing with in Uganda?
It goes, it's without a doubt that the inequalities already from these few months have significantly increased. The capacity of the brain that has been built from the children that have been able to access some form of learning is far beyond what these other children are going to catch up on once they get back to school. And as long as there is this prolonged uncertainty, without any meaningful intervention, we are going to see a further widening of inequalities. And like I told you, it doesn't impact only education as you see it. It impacts things like the labor force. It impacts things like the health of the kids that are not going to school. But the mental health of the children. Many children are asking, when are we going back to school? Because they are not seeing any learning. They are not experiencing any learning.
Salima
And
Namusobya.
if we are going to say as Ugandans, we are champions for the sustainable development goals, we have to actually mean what we are saying. The SDGs, all of them, education, health, gender equality, you know, like everything, poverty. These are things that the government has to address.
I'm afraid we've run out of time.
Well.
Salima Namusobya, thank you for your time. Yes, she is the Executive Director, Initiative for Social and Economic Rights. What I've gotten from this conversation, the right to education, the right to health are both intertwined. My name is Romy Busiku. To all the kings, queens, boys and girls who are celebrating their birthdays on this particular Tuesday, please enjoy